And we're back. We're back in action. Sorry about that. But had some technical difficulties. But anyways, back to unity, back to creating a movement that's in protecting our children. So we're exposing a lot of these tactics that I will call them the enemy, because that's what they are. These people that are money over children and money over everything, money over morals, money over God, money over, ethics. They're money over anything, money over life. And so they're the enemy of life. That's the new name, the enemies of life. And because anytime you can try to destroy a child and it doesn't bother you, you're an enemy of life. And you're very evil. And so, and a lot of them are dressed up in nice suits and business attire and look professional. And we think that we trust them because of their field, but not realizing what's really going on. And like I said, this is not a conspiracy channel. This is not a religious channel. This is not a political channel. This is a truth channel to bring the truth so that eyes can be open, ears can be open, and that people are moved to action. And that action is unifying, taking our kids out of these schools, building private schools, building charter schools, building Christian academies, providing a safe haven with, because there are parents, there are teachers that do not agree with what's happening. There's doctors that don't agree with what's happening. And so when you're only hearing one side, you think that's the real, but you have to, we're getting information from people that have already been through these processes, going through these processes, or involved in these processes on both ends, on good and bad, good and evil. So we're producing these things, with the help of my great team, which I'm grateful for and greatly appreciate. And all those that have joined this cause, have joined this fight of saving the children. And so we're going to play some videos, again, with more data and more stats and more facts that, and more testimonies. That's one thing, live testimony, you can't deny it. When someone has been through it and they living in it and they're going through it, you can't, and they have their experience and it's real and it's documented, you cannot, you can't combat that. You can't argue that. You can just choose to stay delusionized and ignore truth, which people do in this time. But there are those that we're looking and seeking for truth, right? So we're going to go ahead and play some videos, and I'll commentate on the videos as they're coming through. But yeah, we have doctors and we have real stats that are coming out. So let's go about these puberty blockers and about what these people are doing and the origins of puberty blockers, what they really are for. Go ahead.
When children are put on puberty blockers, in almost all cases, this leads to cross-sex hormones. And the risks are now becoming clear. Sterility, depression, lifelong...
Using drugs to pause puberty for children questioning their gender has become one of the most controversial and polarizing topics of our time. For some, a medical scandal.
You go to the professionals and you're like, look, I'm just a parent, I don't know what's going on. Can you please help me? And then after a couple of hours, they're on the pathway to hell.
But for others, life-saving.
If you don't give these children help, they're going to find another way, especially when...
But despite clinics administering so-called puberty blockers to children for a quarter of a century, little is known about their long-term effects. Now, a new analysis seen by Newsnight sheds some light in this much debated but little understood area of children's medicine. Puberty blockers work on the brain to stop the release of sex hormones. That then prevents things like periods and breast growth in girls, and Adam's apples and breaking voices in boys. These drugs aren't licensed to be used this way. They're approved to treat prostate and other cancers, endometriosis, and to chemically castrate sex offenders. In children, they're only approved to delay the onset of early or precocious puberty, where NHS England says the evidence base is strong and the clinical approach is not contested. The lack of a robust evidence base for their use in treating gender dysphoria has led to a radical rethink by the health service. Puberty blockers will no longer be routinely given to children on the NHS, only to those taking part in clinical trials. This more cautious approach is happening in other European countries too.
It was first of all when I was doing the book, and then later on when we were doing the analysis.
David Friedman is a retired social science researcher. In the 1990s, he edited a book on young people with gender dysphoria with the founder of the Tavistock's Gender Identity Development Service, or GIDS. He then carried out an audit of children who'd been referred to GIDS up to that point.
Where they would differed from the general population was in areas such as disrupted home life, areas around sexual abuse, living in children's homes. And then there was a great deal of associated psychopathology, emotional upsets and disturbances and things like that, much more than you would have found in the general population.
What was the purpose of the audit, in your mind?
I assumed that from the work we'd done, that we had given a basis for further audits and research that would then, they'd have had a baseline to compare with.
That's not what happened. This first comprehensive audit would seemingly be GIDS's last too. I first spoke with David Friedman about it last year.
I remember my jaw dropped on the end of the phone. You hope and assume that as part of the skill and part of the clinical decisions that are being made in the care of your children, that it's being made based on the best available evidence, and that that evidence is as up to date as possible. And it seemed to me that this had stopped happening at the GIDS. I felt children were actually being abused, that they were being entrusted to a service that was not offering the best possible treatment to them. And I felt completely alone. I didn't know what to do.
What David did next was to contact Professor Susan McPherson, one of 3 others who'd carried out the GIDS audit with him so many years before.
And so I looked her up and found that she's now a university professor, and that she has a special interest in looking at the outcomes of mental health treatments and looking at change over time. And I wrote her a very polite email, "Dear Professor McPherson, I don't know if you remember me." And then we met, and we just talked.
As they talked, they were drawn back into research together, this time on puberty blockers. The pair reanalysed a landmark GIDS and University College London Hospital study of 44 12 to 15-year-olds given puberty blockers. In 2021, the team reported there'd been no changes in psychological function, no benefit, no harm. Despite that, back in 2014, the study was used to justify a permanent shift to making blockers available at much younger ages. The GIDS and UCLH team stressed that although they couldn't show any benefit to these young people of being on puberty blockers, it was also the case, and I'm quoting, "It is unlikely that the treatment resulted in psychological harm." The study used scores from reliable and widely used parent and child questionnaires that assess children's behavioural and emotional problems. As is a standard way of looking at data, the official results were based on averaging these scores.
We both, in talking, basically said, well, in this situation, the mean is essentially meaningless. Because if you've got 44 young people, let's say, and let's say over a period of time, 11 do extremely well on the puberty blocker. 11 do quite well, 11 do extremely badly, and 11 do quite badly. And you make an average, you get oh, no change.
The Tavistock have made the study's raw data available to others. When McPherson and Friedman reanalysed it, exploring changes at an individual level, they found something very different. The mental health of the majority of children was significantly impacted, for both good and bad. After 12 months of puberty blocker injections, 34% had deteriorated, 29% had improved, 37% were unchanged. To be clear what this means, a child who deteriorated could be moving from being psychologically well to meeting criteria for a psychiatric diagnosis, such as depression or anxiety. A child who improved could be moving from needing mental health treatment to being considered well.
Well, the big difficulty is that you lose sight of the individuals.
Professor Chris Evans is a retired psychiatrist and psychotherapist. He's an expert in the statistical method used in this new paper. It's called Reliable and Clinically Significant Change.
This is a much less used technique, but it's actually a very respectable technique. It's probably been used in hundreds or thousands of studies. It goes back to people saying, well, actually, practitioners tend to be more interested in what happens to individuals. What they found was there's a huge amount of diversity here, far more than we'd expect just from measurement unreliability alone. And that, in a sense, is a pretty vital complement to the first report.
What neither the original research paper nor this new analysis can tell us is why these young people fared so differently. We can't infer cause and effect either. We can't say that these changes in well-being were caused by being on the puberty blockers because of the way the study was designed, without a control group. Plus, it's a small study of just 44 young people. But despite these limitations, this new analysis raises important questions and certainly suggests the need for more research, both into this specific group of 44 and on puberty blockers more generally.
Going forward, the more information you have, the better. And it may well be that there are children who, even at this young age, will benefit from being on the puberty blockers, but there are children who might be harmed. What we're talking about is children with their families making decisions that very possibly are going to have consequences for the rest of their lives.
Both UCLH and the Tavistock and Portman Trust said they welcomed new evidence around how to support this group of young people. A Tavistock spokesperson said that the analysis plan for the original study was independently produced by experts in medical statistics. A spokesperson for UCLH said it would work closely with the new National Research Oversight Board to support the collection and analysis of robust data in this area. This new analysis isn't peer-reviewed yet. Dr. Hilary Cass's team, which is reviewing children's gender identity services, told us it would be taking it into account, along with an updated evidence review, when making its final recommendations later this year. The NHS is hoping to improve our understanding of puberty blockers in new clinical research. That can only benefit everyone, those who might be helped and those who might be harmed.
So, bottom line is there's not enough research, but we have more videos with more doctors, with more research and more facts. And what these were originally made for, which was adult men for prostate cancer. That's what puberty blockers were originally created for. And then during the last several years, they've been turned into, I think it's 40 years, 30 or 40 years, they've been turned into, to pause children's puberty, which is insane. One of the videos, a guy says that they're using our children as lab rats. And this is very much the truth. So we're going to go ahead and play some more. Now, the next video is a video of someone trying to promote them, someone that used them and is trying to... See, you always have the people that are are promoting it and making it like it's good, and then denying the facts and saying that the facts are wrong, right? And so we have more people coming out saying their experiences are hellacious and atrocious and life-altering, which we've played those videos of many that their lives have been destroyed and body parts removed and cancerous situations from puberty blockers. We just played you last week a lady who's in her 40s and has children and was saying that she'll never be a man. And no matter what, they lied to her, and doctors are lying to people. So let's go ahead and play the next video.
These puberty blockers are safe for non-trans youth. They should be safe for trans youth.
In July, the U.S. Food and Drug Administration added a warning label to puberty blockers after 6 biological...
And is most famous for her role in Orange is the New Black. Laverne received a medal that is Harvard's highest honor in the field.
We got to reset the video.
It froze. So, 1 second.
Technical difficulties we're fighting through. So anyways, while we're waiting on that, we have a responsibility. Once we hear this truth, once we see these things, we have a responsibility. And that is one of the main messages I'm trying to get out to adults, people that love children, people that have children, people that believe children are precious. We have an accountability and a responsibility to protect them. And so please share the link. Please share the information. Please hit the subscribe button. The more it's about, the more awareness is the goal. And so, and we're greatly appreciated for those that have, I was sharing this with people in South Africa, and they were very intrigued and said they would be joining the channel. Hope you guys are watching. But we will continue to spread the word globally if we have to. That's what we're doing. But also, locally, so that we can get, we got to get at least 10,000. That's a goal. We got to hit 10,000 students. If we can hit 10,000 students, that's 5 million that the schools will not get. There we go. Students' inaugural stay home. In support of parents' rights, which these people say that we don't have a right. And we say we do. So we good on the video? We ready?
Restart the computer.
Oh, okay. So there's the week 9/30 through the 4th of October. September 30th through October 4th. And please start preparing and planning now. Get together with those that we're going to do, babysitting and taking turns, families taking turns on, maybe a day or two each family. Mothers, single mothers can get together and take some paid vacation, and you take 2 days, another one takes 2 days. There's many different strategies, but if we work together, we can have a great impact, and that's what we're looking forward to. We ready to go?
I believe so.
All right, let's give it another shot.
These puberty blockers are safe for non-trans youth. They should be safe for trans youth.
In July, the U.S. Food and Drug Administration added a warning label to puberty blockers after 6 biological girls developed symptoms.
Just kidding.
Maybe just try to play a different video. Maybe it's just that video's messing up.
I got it now.
You got it? All right.
Yes.
Let's roll.
And action.
If these puberty blockers are safe for non-trans youth, they should be safe for trans youth.
In July, the U.S. Food and Drug Administration added a warning label to puberty blockers after 6 biological girls developed symptoms of tumor-like masses in the brain.
Laverne Cox is a famous transsexual actress and is most famous for her role in Orange is the New Black. Laverne received a medal that is Harvard's highest honor in the field of African and African American studies. Here's a clip from her acceptance speech.
Every time you hear the misinformation that puberty blockers are dangerous, tell people, let them know that puberty blockers have existed for over 40 years, over 4 decades. And initially, puberty blockers were prescribed to non-transgender children for precocious puberties and were found to be safe. If these puberty blockers are safe for non-trans youth, they should be safe for trans youth. It's misinformation, it's propaganda, and it is threatening the lives and the existence of trans kids all over this country. We have to push back against that, and we have to do it with love.
It's true that we treat precocious puberty with puberty blockers, and we have been for decades. If we don't treat it, the child might end up shorter than the average adult. The earlier they grow, the quicker the growing stops, kind of thing. But there's still some risks with using puberty blockers to treat precocious puberty, such as problems with bone density.
Precocious puberty is treated with puberty blockers. For example, a girl at age 5 or 6 might get a Lupron implant. But if a girl seems to be starting puberty at age 7, the current recommendation is not to use puberty blockers because the side effects are too significant.
So from a medical perspective, we avoid using puberty blockers as much as possible. And I find that very interesting. But it makes sense. Puberty blockers are not something to play with. What's important to remember is that we've been using puberty blockers throughout time to treat a physical condition. What we haven't done for a very long time is to give medicine to healthy children. The consequences of giving puberty blockers to healthy children are heartbreaking, and the list is unfortunately long. The physical risks are bone density problems such as osteoporosis, infertility, lack of sexual pleasure, never achieving orgasms, and underdevelopment of genitalia, micropenis.
In July, the U.S. Food and Drug Administration added a warning label to puberty blockers after 6 biological girls developed symptoms of tumor-like masses in the brain.
I think that's amazing they added the warning label. I just thought it was already there. I'm so naive.
One of the girls reportedly was receiving the puberty blockers for purposes of gender transition. The new label warns of headache, blurred or loss of vision, pain behind the eye or pain with eye movement, tinnitus, dizziness, and nausea associated with tumor-like masses in the brain.
Speaking of the FDA has since the 90s approved puberty blockers to treat precocious puberty, but has never approved them for gender dysphoric children. I was actually quite shocked when I read that. So doctors or pediatricians, they're giving this medicine to children off-label. I know that off-label use is common and it's generally legal unless it violates ethical guidelines or safety regulations. So with the risks I just mentioned, can we have a talk about if this should be legal to give to healthy children? I'm open to have that discussion. It's not only physical changes and risks of puberty blockers we see in children, it especially affects the development of the children's brain. Some kids experienced brain fog and some even a lower IQ. You know what's also a big part of a child or young teen's development? Their sexuality.
The development of desire is mediated by the sex steroid hormones. And if you've blocked them, then you've also blocked that development in the child. And this is significant because over the past 40 years, as you've already said, the majority of gender dysphoric small children were male, and a lot of them had their gender dysphoria dissipate with the onset of puberty as they slowly came to realize that they were gay. This was the most common outcome. If you block the puberty, you block that development.
I refuse to believe that giving children puberty blockers will give them a sense of freedom, the freedom to express however they want and to discover themselves. I think that's the biggest lie that the trans community spews. Children are not able to discover themselves and find out who they really are if we're pausing their development. And you don't need to go to med school to understand that. It's simple. We cannot and we should not pause children's development. It's unethical. We don't have the right to do that. The child's future sexual health, physical health, mental health, and fertility, that's all in the hands of adults because they cannot consent themselves. We don't know for sure if these kids will actually continue to feel gender dysphoric as adults, especially in today's climate, where we see this huge rise with kids believing they're trans. We should not punish these kids for believing that they're trans, even though they're not. I don't want to see them suffer, but I believe they will suffer in the long run if we pause their development and we affect their fertility and sexual health. The last thing I want to cover about the 30-second clip of Laverne Cox, I'll just play it again so you remember.
It's misinformation, it's propaganda, and it is threatening the lives and the existence of trans kids.
I think it's a little bit funny how these trans activists openly admit that trans kids are only valid if they go through the medical transition. They make it sound like trans kids' entire existence is all about the drugs and surgeries, which is weird because I thought that the same activists claim that you don't need surgeries, you don't need hormones to be trans. Everyone is valid. That's all I have for you today. Thank you so much for watching. Remember to hit subscribe, hit the notification.
So as we see the hypocrisy and the lies and the deception are continual, and notice how Harvard, so many people, it used to be, a great accomplishment if your child went to Harvard and graduated. And look, they're given the highest medal achievement in promoting to give the children these life-altering and life-changing and life-destroying. Like, the video of the young man we saw with Candace Owens, he's not going to get up there and say what that person just said. That man just said. Right. He can't get a hold of his doctor anymore to get rid of the knives that are inside of him that he said is continual. And the doctor said, put some more lube. And here, let me refer you to 2 more doctors that if you do the surgery, they'll kill you. And those doctors said, we're not going to do the surgery because it'll kill you. That person is not getting up saying, let's give this to our kids. Nope. And, as it was brought out, it used to be used for, we haven't got to the video where it talks about them men with cancer, prostate cancer. But, it's the truth versus the lie. Yeah. And people have to decide, you have to decide. Do you believe the truth or you believe the lie? Do you believe the truth or you believe the deception, the corruption? And then he was funny how he was saying that to have it against the transgenders is propaganda. Like all the trans kids don't fall underneath the propaganda. No, the propaganda is getting them to take these pills and mutilate themselves. 100%. That's the propaganda, because guess what? Him making that speech and that statement at a ward, he's getting a check. That man that's looking like a woman, he's getting a check. He got a check from Harvard. He's getting a check from the transgender, the enemies of children. He's getting a check. But those ones that we're getting the interviews of and their lives are destroyed, they're not getting a check. Nope. And as you heard last week, the lady said she had 7 surgeries, and then the insurance cut her off. Yeah. So the medications and things that she needs, they don't talk about once you get those surgeries. She said she had to go through 18 rounds of antibiotics. Yeah. That's not cheap. Those things are not cheap. And then she even broke it down. I think she said it was, what, $700 a shot or something like that. It was wild. And guess what? Everyone that does that, they have to have that. Yeah. Mm-hmm. That you have constant open wounds when they do these surgeries. They're open wounds that never heal. So anyways, we still got some more videos to get through. Let's get through our next one.
Just reemphasize one of the points. Puberty just can't stop like it's a movie, right?
Yeah, it doesn't work that way. It's a healthy process in the human body, and as you heard from Scott Nugent, that's a trans, a woman who transitioned to a male. Although she says in the film, she's one of the only honest people we talk to, and she says, "I transitioned to appear like a man, but I'll never be a man." Anyway, as we hear from her, that there are no studies that have been done on this whatsoever. We've never had a generation of kids that has had this done to them. Like, they're lab rats. So we're just kind of trying this out on a whole generation of kids. But based on what we do know, we know that these are serious drugs. A little bit later in that same interaction, we talk about what the actual drug is. The actual puberty blocking drug is Lupron. That's what it's called. And it is used off-label to, quote, block puberty. It is actually a cancer drug for prostate cancer that you give to adult men. And at a certain point, they realized it had chemical castration properties, so they started giving it to sex offenders to chemically castrate pedophiles. And now we give it to 12-year-old boys. And I asked that pediatrician about that. I said, Lupron, that's chemical castration. And that's when she said she wanted to get up and the interview was going to be over. She didn't want to talk about it, but it's absolutely true. And this is what we're doing, not just to a couple of kids, but to thousands, millions of kids.
Yeah, so the question is also, how widespread is this, right? We know the pharmaceutical industry has done such damage to our country, especially over the last couple of years. I mean, you want to look at kind of one of the major enlightenments is how people don't trust Pfizer, AstraZeneca, Johnson & Johnson, and Moderna anymore after the damage they've done. But this is an interesting wrinkle where people don't realize it's not just the pharmaceutical companies that are pushing antidepressants on you unnecessarily. And by the way, they might make your depression and anxiety worse, just so we're clear. So be very careful before you go on benzodiazepines or Prozac or Xanax. But it's not just that, but the pharmaceutical industry is involved in this trans issue. There's billions of dollars to be made in new FDA-approved puberty blockers, and then with it, the benzodiazepines and these other drugs that could also accompany it. Talk about the pharmaceutical profit motive involved in a lot of this.
Well, as you just said, billions of dollars. And anytime there's billions of dollars involved, then we know that that's reason enough for skepticism. When it comes to chemically castrating kids, that should be the entire reason that you need to be skeptical of it. But there are people that are making billions of dollars, and it's not just the pharmaceutical industry. This goes to therapists. You know, there are therapists that used to just be regular old therapists, and then they realize that the real money is in the gender-affirming game. And that's where you can really make the money. That's where you can find all the clients. And so this is all they do now is they do gender-affirming care. And then there are, you know, endocrinologists who this is all they do now is give out the hormone blockers and everything. There are people who have realized in therapy, psychiatric industry, the pharmaceutical industry, the medical industry generally, that there is lots of money to be made here. And so they have no incentive. You know, if you've got a 5-year-old boy who has now had this gender confusion foisted on him, there's no profit incentive in helping that child overcome the confusion and just live as a boy. I mean, that boy, there's a dollar sign over his head. That boy is worth millions of dollars in the long run to lots of very powerful industries.
And you know, I've been saying these things for years, and it's encouraging to see others that are confirming these things about the money. As you heard him said, I've been saying that from day one. It's a dollar sign on our children's heads, and actually broke down the stat last week, and it said that each child that they can transform over into the transgender agenda equals out to about $1.3 million per child. So they don't care about the development of the child. They don't care about the parents, how they feel about it. They don't care about any of that. They see every child that they can sit in front of them, every child that they can confuse. As you heard him say, they put it on the 5-year-old child. No child just automatically thinks that, oh, I want to be a boy, I want to be a girl. That doesn't happen. There's an adult somewhere that has abused them, lied to them, enticed them some type of way to where that thought process gets entered. This is like a seed. Once a seed gets planted and it starts getting water, then the seed grows. So these adults, as we've showed in many, many episodes, where there's educators, there's the creators of curriculum, we've had videos exposing them having conversations they didn't know was being recorded, and them being wholeheartedly truthful and saying the younger they are, the better for our agenda, and how we're able to control them, and creating ways so that the parents won't find out. All that is considered evil, deceptive, and about money. And these are the people that he was just talking about. There's people making billions off of our children and off of us being naive, unaware, skeptical, curious about, because we don't have the answers, so we turn to someone that went to a man-made institution and think that they have the answers because they studied a couple books for several years and got a piece of paper that they put on the wall that says, now that I have the ability to diagnose you and make, between 7 and 70,000 if I can butcher you and your child or butcher your children, hey, trust me. And we go, yeah, we should really trust them, and not realize that this is strategic. This is planned. This is plotted. This is schemed, and our children are the targets. And so, we have to stand up and say we're not. This is not allowed anymore. And that's how we do it. As you see, since they're only money driven, we have to hit them where the money is. Yep. And that's what this Stay Home Week is about. And that's what getting finances to build schools, buy land and build schools. That's what this is about. And so, just praying that this word gets out more and more. We have one last video, which is a doctor really breaking it down. Yeah. And I believe he's a father. He has to be, the way he's talking. But he's a real doctor, and he breaks it down to the nitty-gritty what's really going on. So let's go ahead and play that last video.
Gender dysphoria is a condition where a person's physical, biological sex is one, say a boy, but in the person's mind they think they're really a girl, or vice versa. It's not something that you can identify on any objective test. You can't do a blood test, for example. You can't do MRI imaging. You can't do genetic testing to actually find this gender identity. My name is Dr. Michael Laidlaw. I'm an endocrinologist in Rockland, California. This gender identity, which is really a child saying, I believe I'm this, I believe I'm a boy, I believe I'm a girl, something opposite of their body. Once they say that, they go down this road of gender affirmative therapy. That consists of social transition, wearing, say, stereotypical clothes of the opposite sex to pretend that they're the opposite sex, then these puberty blockers, then these cross-sex hormones, and then finally surgical modifications to the body to try to make the person appear that they're the opposite sex. Puberty blockers are powerful hormones. They act on a small gland in the brain called the pituitary, and this controls the sex organs. For example, testicles make testosterone, ovaries make estrogen, and the pituitary controls that happening. Now, these blockers stop this action, and then whereas, say, a girl is in age 9 and continuing or beginning to develop in puberty and should continue on until a full adult woman, it's stopped. Once you stop it, there are various harms and problems that occur afterwards. Unfortunately, many of our professional organizations are advocating for this, including Endocrine Society. And it's important to bear in mind that there's very small groups of people controlling these societies. Small groups of people are making these pronouncements, and then when physicians want to turn to what's the best practice, they're finding these things. And there's no rigorous research done. There's no controlled studies. It's very poor research, but it's, I guess, politically correct to go down these roads by these organizations. Doctors will feel compelled to follow what their organization says without really looking into the evidence necessarily. There is heavy-duty propaganda basically going on, but these gender clinics have sprung up and have multiplied all across the country. The numbers are going up around the world, in the UK, Canada, here, other places. More and more kids are being diagnosed with this, and there's a social contagion component. People, kids going on to YouTube, Tumblr, things like that. So the cases are rising. It's a major problem that we have to address. In my practice as a physician, I always look at side effects of medications before I give anything to anyone. Say for diabetics, I always tell them, if you can work on your diet and exercise first, I'd rather have you do that than take these medications, because there's side effects and there's problems that are potential. But if you need it, then you need to take it. With this, I can see no need to take these medications. I see the risks as being very high, and I see children as a very vulnerable population, can't speak up for themselves, and their parents are often propagandized by this movement. I've met a lot of these parents. My heart goes out to them. I've seen their kids and pictures of the kids, and really, it's about helping kids.
That's what it is. It's about helping kids. And as you heard him say, a population of children that can't defend themselves.
Yep.
That's what this is about. And like you heard in the previous video, the guy on the Turning Point USA, he said, we've never had a generation of kids where they're confused. And I mean, just think about it. All throughout the history of mankind, you cannot find a single generation that were confused about if they were born a boy, were they really a girl, if they're a girl, they're really a boy. That didn't start happening until we start pushing that. In America, we start pushing that.
Yep.
And so you can't find any other time period of mankind where there's this mass confusion and manipulation of children. Now, there's always been manipulators and deceivers for the gain of money. There's many different experiments that have been done on people, on certain ethnic groups. These things have always happened. But to specifically target all the children, to confuse them and guide them into a butchering process for lucrative gains. This is the scripture talks about that there will be inventors of evil, and that's what they've done. This is another invention of evil. How it is profitable to kill them, abort them and kill them so that they can make collagen, and you can make face creams and body anti-aging things. Yeah, that's what they use the body parts of the embryos, the babies, the umbilical cord, all of that. They use that for what? Money. So they lie and they hide under the Equal Rights Act and Equal Rights speech, but in all actuality, it's to make more money. The more children they can kill, the more profit margin they gain, the more children they can confuse and butcher. See, before, when they would kill the child in the aborting state, they only can make so much money. But now a child that's going to grow and become an adult, once they get these surgeries, they have to continually get medications, antibiotic treatments, like that goes on for the rest of their life. Which is what? That means a consistent residual of income. So if you get a child and you start them at 9 or 10 years old, by the time that child is 30 or 40, if they make it to that point, then you've cleared almost $1 million. And so that's how they're looking at it. They're looking at it as a long game. So if we can already convince them to kill them in the womb, then we can convince them once they get born that they're really a girl and they was born a boy, and don't tell your parents. Yeah, that's you got to understand. The scriptures talk about these things and these people, which we're gonna read some today. We're gonna go to 1 Corinthians. That's the first one we're gonna put up. 15. Okay. It says, do not be deceived and misled. Do not be deceived and misled. Evil companionships, communion, associations. That's who these people are. And the Bible is telling us to be aware of them and do not listen to them. See, the number one problem is our parents is we're taking our children to psychologists and psychiatrists who you just heard the man break it down, who prior to that, they're not making much, but now they've found a lane that they know if I can get these people, if I can diagnose them with this transgender thing, my check increases 10%. I mean, tenfold, not 10%, tenfold or 1,000-fold. And so they've seen this as a pathway to boost their income. And so the Bible says, don't listen to them. Don't allow them to mislead you. It's just like Chloe's parents. And it's sad because they went to the doctor, and the doctor gave them two options. You can either have a happy son or a dead daughter, because they had a daughter, a happy son or a dead daughter. And so when you listen to those people, guess what? They're deceiving and misleading the parents. You have a daughter. How is she going to die other than you kill her? You have a daughter. Okay, she's learning herself. She's going through puberty and going through all of these things. And instead of saying, hey, take time, hey, how about prayer? These things that actually really help. No, it was, you're going to have a dead daughter. If you don't do the surgery, let's keep the verbiage right. If you don't do the surgery, then your only options are a dead daughter or a happy son. And guess what? Chloe started down that process, and she didn't end up being either a happy boy or a dead girl. She's now a saddened and an advocate for these people to stop doing what they're doing to the children. She went before Congress begging them to stop allowing these doctors, allowing these psychiatrists, psychologists, allowing these professionals, allowing these school teachers, stop allowing them to do this to the children. And so it says, it says, corrupt and deprave good manners and morals and character. So meaning when you listen to these people who you think they're professionals, you think they have your best interests, but in reality they're deceiving you and misleading you, it's saying that when you listen to them, these are the things that happen. Well, if you do have good morals, they get corrupted. If you do have good manners and have known of a person of good character, that gets corrupted from listening to these people that seem to be professionals and seem like they have you and our children's best interest, and really in actuality, they're deceivers and evildoers and inventors of evil, right? Now let's go to another scripture in Romans 1. It says, verse 28, it says, and so since they did not see fit to acknowledge God or approve of him or consider him worth the knowing. Listen, it's another big thing. None of these people are talking about God. None of these people are talking about who created us. They're not even mentioning that. So they're trying to do a study of the body which they didn't create. And really, if you really want to know the truth, massively, doctors know probably about 10% of truly how the body functions and works. And that's just real because everything is experimental. They're experimenting because they don't know. It's the practice of medicine. Practice means we don't know, so let's try this, just like a mechanic. I don't know why your car is making that noise. Maybe it's this. And then once they fix that and the noise is still there, you go, hey, I just paid you, $300 or $400 or $500, and my car still make. Oh, well, it's trial. Or we thought it was that. We can check it out again for another fee. That's the game. Yep. Well, that's the same with the doctors. The doctors are trying to figure out, but they're not praying and asking the Lord. Most of them, let's say that. There are good doctors. There are good mechanics. And there are bad doctors and bad mechanics. Well, what happens is when money comes involved and it becomes an enticement and a luring, then those that are weak in character and weak in morals, they yield. Yep. They fall for it. And so that's what you heard the doctor was saying. He's saying, their doctors are part of these organizations. And if the organization says we're going this way, then 90% of the doctors go that way, and they don't even do any research to find out, well, wait a minute, is this way going to cause more deaths? Is this way going to cause more illnesses? They don't ask those questions. They just say, oh, okay, well, the board voted this, so, we got to do what the board says. And the board is saying, get as many children as you can and chop them up. Get as many young adults you can and diagnose them with this transgender thing so we can get more checks going. Your check gets bigger, our check gets bigger because we're charging the insurance, and the insurance is on the game too. Because they get their kickback. Everyone's up out of the money game. And so that's what we're doing. We're exposing the money game people, the people that think that they run the world by the control of money. But they don't control the world. And they have a judgment coming. And so it says God gave them over to a base and condemned mind to do things not proper or decent, but loathsome. So meaning when they don't reject God and man says that I have all the control and I have all the understanding and I have all the knowledge and let me infect people with that, then guess what? That's all their mind can think because the Lord lets them have that because that's what they want. All they want is money. All they want is destruction. So the Lord hands them over to their wants and their desires. And at the end, it's a bad ending. It says, until they were filled, permeated, and saturated with every kind of unrighteousness. That's those 500 doctors that we talked about. They're there. That's those psychologists and psychologists. They're there. Those that are influencing that. Whatever the locks, whatever the man's name that had the blonde wig that was getting an award from Harvard, that's where he's at. See, they say, oh, that's a woman. No, it's not. It's a man. It's a man. Laverne? Yeah, Laverne Cox. That man, he's in there. It says, with every kind of unrighteousness, iniquity, grasping, and covetousness, greed, and malice. See, when you're all about money, you have all of that. Yep. You operate your mind, your heart, everything is that. And it says they were full of envy and jealousy, murder, strife, deceit, and treachery, ill will, and cruel ways. When you can cut on a child, when you can convince a child, you are cruel. And you're treacherous. See, we got to stop being afraid to say these things. We're talking about children. Anyone that has says something to say about the children get to decide, and the children, there's never been that way. Oh, it's a new day. No, it's not a new day. It's just a new evil that's being presented. And evil always has to be addressed with righteousness and truth. It says they were secret backbiters and gossipers, slanderers, hateful and hating God, full of insolence, arrogance, and boasting, inventors of new forms of evil. That's these people. Disobedient and undutiful to parents. You see that? Yeah. They're discrediting the parents. They're saying that we don't have a choice. We don't have any rights. We don't have a say-so. They got something coming. It says, verse 31, they were without understanding, conscienceless, no consciences, and faithless, heartless, and loveless, and merciless. Every single adult that is for this transgender agenda, that is you. You have no understanding, nor do you care. You have no conscience. You have no faith. You're heartless, and you have no love in your heart, and you're merciless because you'll sacrifice children for $1. So we have to understand the truth and what we're dealing with and what we're facing. If you agree with any of this, that's you. And if you didn't know anything about this, this is how you should look at and identify these people. Because behind your back, they're trying to take your children. We already have it to where we're inviting children to come from other states and leave their parents. And if they make it over here, the state will protect them against their parents. You can't even come retrieve your underage child. That's a law now. It's been a law. So these things are real. And these things are, we have the scriptures to point out and give insight to what the enemy is and who they are. This is not about how prestigious or what degrees you have. This is about what are you using those degrees to do. So anyways, thank you for joining The Truth Unspoken, another episode in the books, more information, more data, hopefully more eyes are being opened. More ears are being opened, more people being provoked to action, provoked to stand. I mean, where's my military guys at?
Yeah.
And mothers. Like, hey, we got to do something. They think when our children go to their schools, they belong to them. No, we the ones that got to feed them, clothe them, nourish them, care for them, nurture them, let them grow. It's our job and our responsibility. Their job is supposed to educate them, not confuse them and tell them turn against their parents and you have the right to be an adult and you're a child. So anyways, hit the like button, hit the subscribe button, share the content, share the links, share the information. Work on what your strategy is going to be from in September when we start this. And let's build momentum. Anybody that wants to meet, anybody that wants to strategize, please contact us. We've contacted people. Donate so that we can buy land. We're looking to get land so we can build schools, so that we can fill these schools up with waiting list of kids and parents that want their children out of the public school system. And all those that have the supposable private Christian schools that are teaching the same curriculum as a public school but charging you $10,000 to $20,000, you got to empty out of them schools too. Imagine that. You got schools that's saying, oh, we're not going to do that with your children. And they're doing the exact same curriculum at the public school. You're just paying for it. Imagine how disheartening that is. And we know the schools. As a matter of fact, that's our next deal. We're going to expose the schools that are doing that. The private and charter schools that say that they're not doing that and they're giving your children the same curriculum, we're going to give you the list of the name of them too. Yeah. Right? Yeah. All right. Pray that you have a blessed night. Pray that you're encouraged and that this ignites a movement, and send out the information. And we'll see you next week on another episode of The Truth Unspoken. God bless.